Lockie is gonna do the entire presentation for this session. For those of you that have not,
They will take it.
I'm just going to remind people to to turn your mics off. As I was saying, Lockie is going to take the lead on this session today. For those of you that have not met Lockie, he is completing a PhD. He's very close to completion.
Yeah, definitely.
I'm going to remind you to turn the mics off until we start our conversation. Lockie is writing on the expansion of, the potential expansion, the ethical underpinnings of the potential expansion of medical aid in dying to people who solely have a mental health condition. And he is completing an internship at LHSC currently. So we're very happy to have him and happy that he's going to do this for us today. Lockie, I'm going to turn over to you.
Sure. Yeah. Thanks. Yeah. Thanks so much. Thanks for the introduction. My name's Lockie. I help provide ethics support and education for health ethics. And today, as we presumably know, I will be talking about AI ethics in healthcare. Before I get into today's topic, I want to start with a land acknowledgement. And so I think we're all joining from different areas. I'm currently in the Komoka area, but I would like to start by acknowledging that we are gathered today on the traditional lands of the Anishinaabe, Haudenosaunee, Unapiwak, and Attawandaron, and that we acknowledge all the treaties that are specific to this area. This land continues to be home to diverse Indigenous peoples, whom we recognize as contemporary stewards of the land and vital contributors to society. Now, a land acknowledgement is only the first step, but awareness is nothing without actions being taken. And so we encourage everyone to be informed with the traditional lands, treaties, history, and cultures of the Indigenous people local to their region. Just some housekeeping again before we get started. Please mute. I'm pretty good at muting people while I go, but it is a bit distracting. But please keep yourself muted. At the end, I'm hoping that I won't go too long and I'll leave ample time for discussion. So at that point, please feel free to jump in. And at the end, please check the chat box for an evaluation form. We would love to hear your feedback on today's session. Okay, so today, as mentioned, we'll be talking about AI in healthcare. And this is because AI as a term, as a concept, is something that is seemingly inescapable today. It seems you can't go 4 minutes without someone talking about AI or an AI tool, what they're using it for, and what some of the risks might be. And this is for good reason. And that's because as AI has developed, it really has advanced to a point that it's becoming used every single day. And so it's actually difficult for us to go through a day without interacting with an AI tool in some capacity, whether that be, intentionally through like say ChatGPT or something else, or even just through the programs that we might use like regularly, like say, for example, Microsoft using its Copilot, even though we might not consciously be wanting to engage with it. And this is really important because while AI tools are or have the potential to be transformative and are transforming how care and other things are provided, the pace of integration is outstripping the regulation and legislation that potentially governs its use. And what that means is we really have to be careful with how we are using AI in healthcare and otherwise, and being really conscious in how we are doing so. And so what I'll be doing today is I'm going to be creating a bit of an argument. And the argument is essentially going to be that AI comes with the potential for such substantial benefits to how healthcare is provided that we shouldn't avoid its usage entirely. Right? These are tools that we should be taking advantage of. However, it does come with very real risks, which I am going to identify. And because of that, we need to make sure that we're being very intentional with how we use these AI tools. However, while I think it requires intentionality in how we use these AI tools, I don't think we can necessarily rely on existing legislation, regulation, and policy. And so I'm going to argue that this is the space for ethics, where it becomes the responsibility of the users, the institutions that are using these AI tools rather, to do so intentionally. I'm going to sketch out a strategy for how we can interact and use AI tools in an ethical way. So in terms of learning objectives for today, I'm going to start off with a bit of a bird's eye view of how AI works and how it functions. Try not to ask me any too pressing questions on how AI works. I'm not a computer scientist, so this is, again, just going to be broad level stuff. But I think it's important that we understand how AI tools function because it can help us understand what the risks are and how it's being used. From there, I'll be talking briefly and broadly about how AI can improve healthcare, and along with the risks that AI can pose. And I'm going to finish with an assessment strategy for how we can intentionally use AI to try to capture the potential benefit or the benefit that exists and avoid the risks. Okay, so starting off, what is AI? At a fundamental level, what AI is just the notion of a machine exhibiting or mimicking cognitive functions that are normally associated with humans. So this would be learning, reasoning, planning, and problem solving, also like sensory recognition, like being able to see and hear. And this is achieved through complex algorithms trained on vast data sets. So some examples of what AI might be would be voice recognition, natural language processing, computer vision, robotics, and things that allow machines to plan, reason, and engage with their environment. So how does AI work? All AI models come with three core components, and that's data input, algorithms, and models. And so any AI tool that you encounter or use will require to have been trained on a huge data set, right? And so all these AI tools are provided with massive amounts of data, which they are then trained on and learn from. Algorithms, in terms of AI, these are just the rule sets or the logic for which the AI functions on. So it's, again, they're provided large data sets. The algorithm is the rule set or the logic by which it analyzes and uses that data. Through the analysis of the data, AI tools create a model. And this is what the AI learns through the process of analyzing the data. There are a few different learning paradigms that AI tools can use, being supervised, unsupervised, reinforcement learning, and deep learning. Supervised learning, this is where, say, for example, I want to create an AI tool that can recognize pneumonia in a scan of the lungs. So I might train that AI tool on a bunch of scans of lungs. And if it's supervised learning, I would label, one scan, lung with pneumonia, another scan, healthy lungs. And so it's supervised in the sense that the data is labeled and used in a particular way for the AI tool to then learn from. Unsupervised learning is where data is not labeled in any way and rather just fed to the algorithm of an AI tool, which is then clustered and sorted. So an example of that would be genomics, where there is huge amounts of data that can't be clearly labeled. And so it's provided to the AI tool and it's then clustered according to patterns that it's recognizing rather than each data set being labeled. Reinforcement learning, I'm not going to talk about too much. That's just how robotics, AI and robotics is trained. And something else that I want to highlight is the last one here, which is deep learning. I'm going to be completely honest. The concept of deep learning is a little bit over my head. I don't entirely understand it still, but this is the idea that artificial neural networks are created with many layers to complex nonlinear relationships. So essentially with deep learning, The AI model is designed to try to mimic neural networks similar to in the human brain. And these AI tools are used to model nonlinear relationships, so things that aren't a one-to-one between input and output. So an example of such a tool would be something like ChatGPT. You could type any number, an infinite number of things into ChatGPT, and it's going to provide you with a response, but it's not linear. Like there's a clear one-to-one connection between the input and the output. And this is really important for deep learning models because these models are so complex, they create what is known as the black box problem, which I'm going to talk about in a little bit. And this is the idea that even the creators of AI tools that use deep learning don't know how it reaches a conclusion from the data that it's provided. It doesn't know how it reaches the outcomes from the prompts. Okay, so that's AI. It's how it works. What do I mean by ethics of AI in healthcare? Just so I'm being thorough, ethics is the study of right and wrong. And so when we're talking about ethics of AI in healthcare, what I'll be focusing on is what is the right way to integrate AI in healthcare. And something that I want to emphasize here is when I use the term AI in healthcare, I am referring to any AI tool that is being used to help in the provision of healthcare. And so this would include, very obvious tools, like say, for example, any tool that's being used to assist with diagnosis, say by looking at scans, like I mentioned. But this would also include other tools that aren't necessarily specifically designed for uses in healthcare, but can be used in healthcare. So, for example, if you were using, ChatGPT and you were helping it using it to help draft policy, that would be example of ethics, AI in healthcare, or even just, if you're using a scribe to record a meeting and the meeting pertains to the provision of healthcare. All of that I am including under the ethics of AI in healthcare. Okay, so I've explained what AI is briefly, how it functions. What is the problem that I'm perceiving? What is the dilemma? And that's the issue that I'm seeing is that on the one hand, AI can be extremely useful. And I don't think this can be understated. It's extremely useful. However, AI can come with risk, okay? And so the issue is how can we take advantage of this extremely useful tool while simultaneously mitigating the risk as much as possible? And so in terms of how AI tools can be beneficial, they can significantly improve healthcare and outcomes, not just in their current use, but also in future iterations as well. And they can help save healthcare providers time and energy. And so any improvements to efficiency can also be a great benefit to how healthcare is provided on a public level. Again, any efficiency in the use of resources would be highly beneficial as well. And so some examples, just briefly as to how AI can impact healthcare or benefit healthcare would be diagnostic accuracy. So they can be used to analyze various scans to help identify abnormalities. They can be used in genomic medicine. Something like genomic medicine probably wouldn't be possible without AI tools. We're not quite at this level yet, but genomic medicine is the idea where the genetic profile of an individual is analyzed. And then from that genetic analysis, healthcare is then tailored to that individual. So some might look at my genetic profile and it might be able to say, okay, based off of genetic information, here is the perfect medication for this individual. We're not quite there yet, but that's something that can/probably will be possible with AI tools. It can help with clinical decision support, dose optimization, population health predictions. So similar to genomic medicine, this is where the demographics of a population would be analyzed and predictions would be made based off of that information. And of course, AI tools can be very beneficial for administrative support. So this could be, scribes for meetings. This could be using ChatGPT to summarize and synthesize articles, emails, help draft responses, all of that. So there's a huge amount of benefit that can happen with administrative support as well. That being said, while there are these really significant benefits of AI, they can come with risks. So what are those risks? What should we be worried about? The main risk that comes up and is discussed the most is the risk of privacy. So AI can undermine privacy in really significant ways, which I'm going to talk about in a second. But also, if not integrated correctly, it has the potential to negatively affect healthcare outcomes as well. And that can do with errors in use and in outcomes. And if it's not double checked, then that could obviously affect healthcare negatively as well. So what are some of these risks of using AI? I mentioned that privacy is a big concern. Privacy concerns come up in the usage of AI tools in a few ways. So one concern regarding privacy is, as I mentioned, AI tools are trained using vast data sets, like potentially millions and millions of data points. When we're talking about AI in healthcare, naturally, some of these AI tools will be trained on data that at one point in time was someone's personal health information. And so it's really important that the data that AI tools are being trained on has been sufficiently anonymized, so privacy of the individual where that data came from is protected. Another concern regarding privacy has to go back to how AI tools function. And so, as mentioned, AI tools are trained on data sets, and then they are deployed for their use case. However, AI tools, when they're deployed, are typically not a final product. And so what that means is AI tools that we use and interact with are actually typically, and I would say the majority of which, are continuing to learn off of the data that are being inputted into them. And so they're actually taking in the data that's being provided to them, and they're using that data to try to improve how they function. So the privacy just isn't the original data set that an AI tool is trained on, but also any new data that is then entered into the AI tool during its use. And so this raises questions as, how is that data being used? How is it being stored? Is it secure? Is it being anonymized? What are the risks in terms of, say, cybersecurity? Could it be hacked and then de-anonymized? But also it raises important questions such as, if it's using the individual's data, will some individuals be able to opt out of its use? So say, for example, an AI tool is being used in healthcare. Could a patient be able to say, I would like this AI tool to not be used because I don't want my healthcare information entering into this tool? So is that something to consider? Privacy also can come up just in the way that, or privacy issues can come up just in the way that AI tools are used as well. And so something that made the news recently is that the IPC issued a report of a significant personal health information breach here in Ontario. And in this case, a meeting scribe was used. I believe the tool itself was Otter AI, if you're familiar with it. And there was a recurring meeting in which one of the individuals in the meeting was using this AI tool to record notes of what occurred in the meeting. Fine. However, a standard practice for this tool is that it would send out the notes that it took of the meeting to all of the individual participants. And this became a problem when, as this recurring meeting occurred, some individuals that were originally invited, no longer at the organization, went elsewhere. And a meeting occurred that talked about health information that was specifically naming an individual, so personal health information. And the AI scribe recorded a transcription of the meeting, and it sent those notes to all of the original meeting invitees. And so individuals that were no longer even at the organization were receiving the personal health information of a patient. And so privacy can also come up in how AI tools are being used. Another concern with AI tools is bias. So bias can enter an AI tool in two different ways. The first is just the creator or the creators of a tool programming bias into the machine, presumably not intentionally. And so if the algorithm or the logic or rule set through which AI tool is supposed to adhere to has bias, then there's going to be bias in the outcomes as well. However, bias can also enter AI in less obvious ways. So again, something I've mentioned a few times, AI is trained on big data sets. However, it's drawing inferences based off of the data that it's being provided. And so if that data is not of high quality, then it can actually affect the outcomes that an AI tool is generating, which can potentially be biased. So a hypothetical example of this would be, let's say, for example, I want to create an AI tool that helps diagnose skin lesions on individuals. And so I am training it on images of skin lesions. Let's say that I also live in an area where predominantly the population has lighter skin. And so I use the data that's easily available to me, individuals with lighter skin. And so the majority of the data that this AI tool is being trained on is of skin lesions of people that have light skin. Let's say it's working for in my test cases, and then it's deployed. However, this AI tool has not been sufficiently trained on what skin lesions look like on individuals with darker skin. And so let's say, again, hypothetically, that it's significantly worse at diagnosing or identifying what the particular issue is for patients that have darker skin. So that's a hypothetical example of how data bias can affect outcomes. A real world example that isn't healthcare is in the realm of autonomous vehicles. So this is the idea of a self-driving car. When these tools were being developed, an issue was being identified where a lot of these cars wouldn't recognize individuals using ambulatory aids as people, right? And so the car scans its environment, it labels people, objects in the environment, and one of these vehicles was consistently identifying individuals in wheelchairs or using canes or walkers, not as people, but as something else, say, for example, a bollard. And this is important because if a autonomous vehicle needs to make a decision regarding where to go, maybe potentially avoid a pedestrian. Oh, maybe I'll avoid this pedestrian, hit this bollard instead, but actually that bollard's also a person. And so we have to be careful in what the data being used for an AI tool is as well, because it can affect bias in outcomes. Another issue has to do with hallucinations. This is just the idea of errors in outcome. So there could be just simple errors in outcome where it's clear what the error is that an AI tool is creating, and those could potentially be fixed. Hallucinations specifically are the notion where an AI tool is generating a response that is entirely fabricated but plausible. And so an easy example of this would be a tool like, say, for example, ChatGPT. You can ask ChatGPT a number of questions and it will always provide you an answer. ChatGPT will never say, I don't know. The issue is sometimes it'll provide plausible answers that are entirely made up. So that's the issue of hallucination. So another issue with AI is that sometimes there are errors and we need to be cognizant of what those errors are and how those errors occur. However, a problem in identifying errors and how they occur refers to the black box problem that I mentioned earlier. So I mentioned with these deep learning modules, it isn't clear how the AI tool actually generates its response or its outcome. And what that means is, even if there's a recognizable error, say, for example, it's known that ChatGPT hallucinates responses, it can be really hard to fix that problem, right? So it's a known problem, but it hasn't been fixed because it isn't clear what is causing that problem. Like, again, the creators of the tool don't exactly know how it's generating its responses. And so if we don't know how a tool functions, then it can be really difficult to understand how it's reaching its outcomes and therefore check for potential errors. And this can undermine trust and accountability. And so that's a broad list of risks that can come with AI tools. However, the problem is actually more complicated than that. So those are risks that apply specifically to, or apply to AI tools in general. But the risks that AI tools present gets changed depending on how they're being used and what they're being used for, not just on what the tool itself is. So say, for example, if it's on the hands-on level of a patient presenting to a healthcare professional, the stakeholders would be the patient, the healthcare professional. It's much more narrow. And so again, the risks are specific to that encounter. You're probably mostly concerned about privacy of the individual. But at the institutional level, say for institution management, like a hospital, the scope is different. There's many more stakeholders. There's the general public outside of the hospital if impacts of the tool affect the overall provision of healthcare at that location. And there's all the employees at the hospital as well. And we can expand the problem even more to policy level. So if an AI tool is being used to generate, for example, healthcare policy by analyzing demographics, the stakeholders, again, along with the risks, increases because there's many more people that can be affected. Again, this is also all complicated as well by who the user is that is using the tool. There can be a tool that is reasonable to use, but if a user is using it irresponsibly or for the wrong purpose, that can also cause problems. All of this to say is that there are some general risks that are identifiable for AI tools, broadly speaking, but the risks also change based on how they're being used and what they're being used for. So I mentioned that AI tools can be extremely beneficial. They've come with numerous risks, which I've identified. How should we address this problem? Solution one is to not use AI at all, right? You can avoid all of the risks if you don't use the AI tools. I would argue this is a bad idea. And that's because AI tools, again, come with these potential, but also current significant benefits to the efficiency and quality of healthcare. And so if we don't use AI tools at all, there is risk in that. And the risk is missing out on the very real benefits of using AI tools. Solution two, implement new AI as much as possible. I would argue this is also a bad idea. And again, that's because AI can negatively impact care in non-obvious ways, right? There's all of these risks that I've mentioned. So I would argue the solution to this problem is to be intentional in the implementation of AI. So this is going to seem somewhat, intuitive, no duh. But if you think about it, you probably know people that fall more under solution one or solution two. So for example, I know some people that are, AI tools are bad, never be used. I think that that's the wrong approach. And I also know some individuals that use AI for everything. It seems like they can't get through a day without using an AI tool for every single aspect. And I think depending what you're using it for, that can also be problematic. And so again, I think the appropriate approach is to making sure that we're taking an intentional approach to how we use AI. So how can we do this? How can we use AI in an intentional way? One option might be to adhere to legislation. So there is legislation that exists that applies to the usage of AI tools in healthcare setting. However, not all this legislation is specifically designed to regulate AI, but rather just can apply to AI tools. There are some that apply to AI specifically, but there isn't much. And the problem is that the integration of AI, the rate at which AI is being used, and the increasing number of use cases that AI has, means that the usage of AI and the innovation of its use is outstripping the rate of legislation. So this creates a gap between what is required of individuals and organizations via legislation and what might be ethically appropriate. And just for our knowledge, the legislation that I've identified that applies to the usage of AI in a healthcare setting at this point would be the Personal Health Information Protection Act. This doesn't have any specific guidance on AI, but rather just has rules regarding personal health information, which can obviously apply to how AI is used. That being said, there is a relatively new bill, came out, I believe, January of last year, got approved January of last year. This is Bill 194, Strengthening Cybersecurity and Building Trust in the Public Sector Act. And this specifically regulates how AI must be used by public sector entities, which would include hospitals. And so it requires that hospitals that use or intend to use AI systems inform the public that they're being used, have an accountability framework, and take steps to manage risk. And so that's a piece of legislation that does apply specifically to hospitals. Okay, so one option would be adhering to legislation. Again, we should absolutely adhere to legislation. I don't know if that's quite sufficient. I would argue that's probably not. What's another thing we could do? We could adhere to policy. So as mentioned, Bill 194 requires that public entities have AI policy. So what that means is the institution that you work for very likely has an AI policy. you should read your AI policy for your institution and you should adhere to it. So you should absolutely refer to your institutional policy. However, policy can be highly variable between institutions. And there may be nuance or particulars that policy may not cover. So as I mentioned, there's a whole whack load of uses of AI tools. They can be used in a number of different ways. And so definitely adhere to your institutional policy. But I think that also there is a role for ethics. Nimra, I see that you have your hand up.
Yeah, hi. So I just have a question because like I'm also in the same field as AI machine learning. So I also did like AI ethics course, but still I think the question I'll pose, it's just like how do existing laws struggles to discuss or address accountability when AI system cause harm, especially in healthcare sector? Because some systems are gonna be autonomous, some are gonna be semi-autonomous, and of course like human is always going to be in the loop, but if there is any harm, who's going to be responsible?
Fantastic question. That's something that I'm going to get to when I'm talking about some ethical principles to govern how we use AI. But something that I would like to mention or point out that Nimra said is that AI tools can be autonomous or semi-autonomous or non-autonomous. What that means is they can run without input or they can run with intermittent input. But again, if something is an autonomous AI tool that's sort of running in the background and an error occurs that causes harm, who is accountable, who is responsible for the harm that causes? That's something I'm going to talk about in a second, but thank you for bringing that up. Okay, so your institution will likely have policy at this point, because again, this is legislation that came out about a year ago, so absolutely refer to your institution's policy. However, I think that despite the fact that your institution may have policy and that legislation exists, there is further accountability that individuals need to take on in using AI tools. And various groups have tried to put forward policies and guidelines, again, on the usage of AI as well. So some examples would be CMPA, HIROC, Health Canada, IPC, CPSO, RNAO. So they'll put forward principles for the usage of AI as well. And so what I've done here, again, because I'm arguing that we should use AI, we just need to be intentional in how it's being used. But I don't think that legislation and policy on its own at this point is necessarily sufficient. It may or may not be because it varies. That individuals need to take a principled approach to how they use AI. And so what I've done is I've looked at the various professional organizations or groups that have created principles for AI usage. I did a literature search of all of the academic articles, or not all, but a great deal of academic articles that talk about how AI can be used ethically. And I've compiled what I take to be the most common ethical principles that come up when we're talking about how we can use AI tools. And so I would argue that each individual using AI or if they're a decision maker within a larger framework, such as an institution, has an obligation to adhere to the ethical principles that are outlined here, which again are an aggregate of research in the field. And the purpose of this is to help mitigate some of those risks that I've identified and to make sure that the benefits of AI are accrued evenly or fairly. So the first principle, again, these aren't in specific order. So it's not like they're ranked, one's more important than the other, but rather these are ones that came up consistently. So the first principle that I would like to identify here is transparency. And this is the ability to explain and verify the behaviors of an AI algorithm. And this is meant to sort of try to help mitigate the black box problem. And so what that means is, again, if these principles can apply both to specific tools as well as to the user of the tool. So that's something to keep in mind. It applies to both. So for the principle of transparency, it's better for an AI tool or the creators of an AI tool to be able to clearly explain and verify how that AI tool functions. How does it generate the responses that it generates? And it's also important that the users of the tool be able to understand how that tool functions. So, because in that way, it's clear how they're using the tool, what they're using it for, and that it's being used in the appropriate use cases. That's the principle of transparency. The next principle here is the principle of fairness. And this is the idea that access to healthcare should be equitable so as not to contribute to disparities or discrimination. This is meant to counteract the bias problem that I mentioned earlier. So we want to make sure that healthcare outcomes can be as equitable as possible given the circumstances. So we want to make sure that AI tools are not contributing to disparities in health. The next principle is trustworthiness. For this principle to be in action, stakeholders need to be engaged. And so what that means is if an AI tool is being used, it should be identified that it's being used, what its limitations are, and individuals, in some cases, should be given the opportunity to opt out of using the tool. So say, for example, this is an interaction between a physician and a patient. In some cases, the patient should be able to say, I would not like this AI tool to be used. I'm not saying that this should always be the case because there could be standard procedure. Once AI tools are used, that's just standardly how that particular piece of healthcare is provided. But we want to make sure that stakeholders are engaged whenever we are using or considering using an AI tool. Accountability. This gets to the point that Nimra mentioned earlier, which is responsibility for the results of implementation. Any user of an AI tool is responsible for how it is being used and what it is being used for. So if you are using an AI tool and an error occurs, you are accountable for the error. Now, this doesn't, let me walk that back a little bit. So there can be known errors, ones that are recognizable, which aren't avoided, which would be the fault of the user, or there can be tools that are used irresponsibly, which again would be the fault of the user. But it's important that the risks of using an AI tool apply to the responsibility applies to the user of that tool. And so it's important that we are not offloading responsibility to these AI tools when we are using them. So what I mean by that is if an error occurs as a result of using an AI tool, the response shouldn't be that's the tool's fault, right? There has to be accountability for the user of the tool. Another principle would be privacy. And this is to ensure that the AI system will not infringe the privacy of users and third parties. Again, this applies both to the AI tool itself and to the user of the AI tool. So, a better AI tool will be one that has robust security precautions to ensure that there aren't privacy breaches for the data that it collects. But it also means that the user is using it in such a way that it doesn't breach individuals' privacy. So again, the example that I'm thinking of is the scribe that was used in the meeting that shared personal health information. That might not necessarily be a problem with the tool itself, but rather how that tool was being used that violated that person's privacy. Humanity. This isn't typically called humanity. This is sort of how I've summarized it. This also goes to what Nimra was mentioning, which is the idea of keeping a human in the loop. So even if we have autonomous systems that can function in the background, they need to be checked on, right? We don't want AI tools to be functioning entirely independently. We want to always be keeping a human in the loop. And this is meant to counteract issues in terms of errors and outcomes. So we want to make sure that those errors can be checked for. And this also would help increase accountability, right? Again, it's the responsibility of a person to be checking in on these tools to make sure that they're functioning appropriately. And then the final principle is reliability. So is this tool effective at achieving the desired result? Again, this would apply to the tool itself. If an AI tool is not reliable in achieving the outcome that it's designed to be used, it's a bad AI tool and should not be used. Okay, so I've talked about these principles. I'm going to briefly apply them to a specific AI tool so we can kind of see what it might look like to use these principles when we're evaluating an AI tool. So the example I'm going to use is an AI scribe. So what is an AI scribe? Sort of in the name, it listens and transcribes conversations. It can structure information using clinically relevant details. It can draft documentation, summarize and condense key details, and continues to learn from corrections and preferences. Now, specifically when I'm talking about AI scribes, I am referring to a physician using an AI scribe to record conversations with patients. So make sure that their notes and documentation is accurate. Okay, so that's what an AI scribe does. It listens to conversations. So for in this case, between a physician and a patient, and it can summarize relevant information and structure it in a way that's easy to enter into the medical record. Okay, so let's try applying the principles that I just mentioned to an AI scribe. Now, I will say that some of this will need to be general because not every AI scribe would be the same. Some would be better than others, depending on how they function. So these would be questions to ask on when you're considering to use an AI scribe and how you would use it if you were to use it. So in terms of transparency, is it clear how the AI scribe functions, how it integrates new data, and what potential sources of error are? So again, the fact that a tool can have errors in outcome doesn't necessarily mean that we should never use it, but it is important that if there is the possibility of error, that it's clear how these errors can occur, because this can help the user avoid those errors. So when considering an AI scribe, are there errors, and can we determine what the sources of errors are so they can be avoided? Fairness. Are there any sources of bias, and can they be mitigated? So for example, when we're thinking of an AI scribe that's listening to a conversation, how well does the AI scribe function when one or more of the speakers has an accent? Is it still as effective at transcribing that information? If it's not, maybe you wouldn't use it in cases where an individual has an accent, or you'd be much more careful in going over the results of how that AI scribe functions. Principle of trustworthiness. Does the user explain that an AI scribe will be used and be able to answer general questions as to how it functions and why is it being used? Is the user open to not utilizing an AI scribe if it risks leading to distrust? Again, I am not necessarily saying that one should only use an AI scribe in this context if they have the permission of a patient. But if it's going to be a common part of your practice, it might be a good idea to inform patients that it's being used and how it's being used, just for the sake of transparency and trustworthiness. Accountability. Does the user check each note for accuracy and clarity prior to signing off? Responsibility lies solely with the user. So again, in the case of an AI scribe, are the scribe notes being double checked? Again, these can save a huge amount of time. We want to make sure that we aren't relying on them too heavily and that every note that is created is being gone over. And again, any errors that might enter the chart as a result of the use of the AI scribe would be the responsibility of the user. Privacy. Is personal health information being stored? Where is it stored, and what security measures does the vendor of the AI scribe have? Again, this would depend on any particular AI scribe that the individual was choosing to use. Humanity. Is the user engaged throughout the process? Again, simply having an AI scribe listen to a conversation and generate a result and blindly throwing it into the EMR would be a bad idea. We want to make sure that we are continuing to be engaged as we use this tool. Reliability. Are errors common, uncommon, or easy to spot in review? So does using an AI scribe save time despite the need for review? Again, this would be depending upon the particular AI scribe being used. So these are some examples as to how these principles can apply in practice, given the example of an AI scribe. Now, a less obvious example of an AI tool, this is something I think is just worth bringing up because its usage is quite widespread. This would be how ChatGPT might be used in healthcare. Something that, again, that's important to consider is the use of the tool, how it is being used, are all ethically relevant, right? And so, again, if you're using ChatGPT to create a grocery list, I don't think there's any serious ethical implications for that. That's not really a problem. Creating guidance for staff, say, for example, if you're a manager, well, you should probably double checking how that information is being created and making sure that it's accurate. Research tool, therapist. So these are all examples of how ChatGPT can be or is used that has ethical implications that need to be taken into consideration. So it's, again, just an example. What I'm trying to get at here is these ethical principles don't just or shouldn't just apply to AI tools that are used very directly in healthcare, but can also apply to other AI tools that are used to supplement different aspects of healthcare. Say, for example, a tool like ChatGPT. I included this because I came across it recently and I thought it was interesting, and I'm just going to throw it out there for the group to think about. But I came across an article where the authors were arguing that a language model should be developed to help provide ethics review for research ethics boards. And the argument was essentially that many research ethics boards don't have access to an individual with direct ethics expertise, so somebody that has like an academic or professional background in ethics. And so they argue in favor of creation of a language model that would help enhance ethical research. And so what that might look like is during an ethics committee meeting, you might put in the protocol for the research and ask it what ethical principles are applicable and how they should be applied and considered. And so a question that we might want to ask is, do we want to be using AI tools to do ethics? And that, just on a side note, I think it kind of really depends on what they're being asked to do. For example, for fun, creating this presentation, I asked ChatGPT what the ethical principles are for using AI in healthcare, and it came up with some good recommendations as to how AI should be used in a healthcare setting. And so, again, some of us might think of AI doing ethics and immediately have like an adverse reaction. But again, I think it all depends on what the tool is and how effective it is at achieving the desired outcome. So in conclusion, different AI tools and different applications present unique risks and benefits, which also change depending on how the user is using the tool. I would argue avoiding using AI is a mistake because it's to forego substantial benefits. However, unscrupulously using AI is also a mistake because AI comes with many risks, which I have identified. Therefore, the ethical use of AI depends on context, how the tool functions, and what it is being implemented for. Because of this, the ethical implementation of AI requires an intentional approach, and I would argue it's beyond the requirements of current legislation and potentially institutional policy, with the responsibility being on the user to uphold those ethical principles. So that's all I have. I'm going to put this evaluation QR code here so individuals can provide feedback if they would like. But at this point, I would just open it up for conversation, comments, questions. You can type them in the chat or you can raise your hand. Heather.
Hi, that was a great presentation, especially from the principled approach forward. Before, it was a lot of review, which was great because some people, as a privacy officer, got to know some of those things, but not everyone does. But I loved the ideas of the principled approach and applying those principles, and especially with respect to the user. Do you have objection, Lockie, to using any of your slides for education with some of our perspective or current users of AI scribes at our hospitals?
I personally do not. Aurelia, will the slide deck be shared? I don't have a problem with the slide deck being shared myself.
Yes, I can do that. So just email me and then I can share it with you. Yeah, that's fine.
I took some screenshots, but I just wanted to make sure that it was okay with you in order to use them. The ideas that you presented and the way to do it, I can see how they can really be used to take some of the anxiety away from the management side, and also give some something to really bite into for the user, that they also feel comfortable, that they're not doing something that they're not sure about. It gives something to really, like, those 7 principles are real. Like, it's a real thing that you can measure. It's not just, oh well, be careful. It's something real.
Well, thank you. No, I'm taking your enthusiasm here as a compliment. My goal was to have usable principles that people can actually look to. Because again, I think people do have the idea of like, there are risks, we should be careful, but what does that actually look like when we're implementing AI tools? So yeah, thank you.
I included my email address in the chat.
Any other questions or comments?
I'm just going to jump in. Thanks, Lockie. I've been throwing in a couple of things in the chat as we've been going along. In particular, some of the guidelines that are applying to physicians' use of AI scribes. So CPSO has got some guidelines there, as does the Ontario Medical Association. So it's those professional bodies are also another source of guidance. I think the CPSO piece, which I've put into the chat, is also fairly clear on physicians' responsibilities and accountabilities when they're using those tools. It still falls to the physician.
Yeah, and I think both the CPSO, the CPSO guidelines do include some of the principles that I've included here. Not necessarily all of them, but they are integrated there when they're providing guidance to the physicians and using AI scribes. I think it might also have a list of approved vendors as well. So that's beneficial in that it's vetting some of these tools, but obviously I think it warrants, further looking into each one, but it can help narrow down the list.
We got a quiet bunch here. Look, thanks again, Lockie. Thank you, all of you, for turning out and participating here. Please, if you can fill in that the evaluation, that's useful for us, and please let us know future topics that you would like us to explore with you. And let me remind you, you can contact us as we do ethics consults, and if you've got particular ethics education pieces that you would like us to have a look at, please let us know. Get in touch. So thanks again to all.
Bye. Thanks, everyone.